My name is Dr. Stefan Ciz. I'm a dentist anesthesiologist. Dentist anesthesiologists typically sedate children, so I sedate children for a living. 90% of my patients are 14-month-olds to 5-year-olds. My typical patient is a 3-year-old with 12 cavities and 6 root canals. As a dentist anesthesiologist, I only treat children under deep sedation or general anesthesia. We have other dentists in the office who are general dentists and pediatric dentists. They treat children awake. They treat children under conscious sedation being laughing gas and drinks. And then my colleague and I, as dental anesthetists, we treat children under deep sedation. Most of the children we treat are either uncooperative or precooperative, and some of the children that we treat are special needs children. It all depends on their situation and on their dental needs. So typically we see parents coming into the office for their first appointment with their child as a consultation appointment. The consultation appointment will kind of give us an idea of what the child's needs are and what the parents' expectations are. Parents may not agree with how we suggest we manage their child's behavior, and that's absolutely fine. Sometimes we will suggest and the parents will say, well, why don't we try something else? And then we do that. Typical children who come in as precooperative children, we will try to get a visual exam as best we can on their first appointment. If that's unsuccessful, then when they're sedated, we'll take x-rays and get a better idea of what it is that their dental needs are. Children that have extensive needs, again, we offer the parents the opportunity to manage their child's behavior in a number of different ways. And then once we explain exactly what it is that their child needs, then the decision is made whether they want to be seen awake or sedated or under general anesthetic. Parents generally have two different areas that they are concerned with when it comes to risks. One is the developing brain, and the second is just a risk of sedation or general anesthesia, or sedation of any kind. The risks for the developing brain. Studies, multi-center studies, have shown that there is negligible risk to the developing brain of a child for any kind of sedation or general anesthesia, except for children who are 1 year of age or younger having multiple operations of 3 hours or more. In that case, there's a slightly higher risk of some kind of problem with the developing brain. Second is, what are the risks of sedation in general? In the province of Ontario, over the last 25 years, the risk of having something bad happen in an outpatient setting for dental treatment is 0.8 in a million. Those are the same odds as getting struck by lightning 3 times. If you separate deep sedation and general anesthesia, the odds of having something bad happen under a general anesthetic I can't give you because it hasn't happened. I think that in creating this vision of Smiletown, where there are different healthcare professionals or dental healthcare professionals working together in one environment, is to provide a facility where all of a child's dental treatment or dental needs can be fulfilled. Because in a comprehensive environment like this, which is unique, there is no other clinic like this that I know of anywhere in the province of Ontario, let alone the country, where different specialists are brought together, working together to make sure that the child's dental needs are met.